Healthcare Sunday on 104.7 KJUL, sponsored by TrueCare Treatment Centers. Now, your host, Warren Zysman.
Hello, Clark County, and welcome to Healthcare Sunday. This is our first show. Want to highlight that we're going to be talking about healthcare issues here in the community. We're going to be highlighting stars in our community who are doing pioneering work, and we're going to be bringing them in so you can hear firsthand from them about the great work they're doing, how they're shaping social policy, and helping people in our community. This is KJUL, the Jewel, 104.7 FM. Today's episode is entitled, What Are Specialty Courts? We're going to be highlighting the positive impact that specialty courts have had here in Clark County. 80% of individuals who've been incarcerated for drug-related offenses reoffend after they've been released from jail for similar offenses or more serious crime. Are these folks committing crimes because they're drug addicted, mentally ill, or criminals, or a combination of all the above? Clark County has 42 specialty courts, which is addressing this issue every single day. They also have one of the nation's first drug courts. Courts in this community have saved millions of dollars as well as thousands of lives. For a $1.4 million grant here in Clark County, it saves the county about $2.9 to $4.2 million in incarceration. And we're able to help people get their lives back together. And we're very, very honored today. We have a very special guest. Her name is DeNeese Parker, goes by the name Dee Dee. DeNeese has a bachelor's degree in sociology with an emphasis in law, a master's degree in criminal justice, and a master's degree in social work. DeNeese is also certified as an alcohol drug counselor in the state of Nevada. And in the past, DeNeese has supervised other counselors and overseen multiple grant-funded programs. Right now, DeNeese is currently the Specialty Court Administrator for the 8th Judicial Court. DeNeese is responsible for oversight of specialty court programs. They include many: adult drug court, mental health court, co-occurring court, veterans court, family court, open transitional age program, felony DUI, juvenile court, gambling treatment court, diversion court, and medically assisted treatment reentry court. Ms. Parker reports to the court executive officer and represents the 8th Judicial Court with the city, state, governmental agencies, and community resource providers. Ms. Parker also provides supervision over the coordinators and specialists operating these courts. So we're very honored to have Ms. Parker here today. She is boots on the ground, doing fantastic work here in the courts, and she has a tremendous amount of insight that she's going to be able to provide us. We wanted to start off by introducing you, Dee Dee.
Thank you very much. I'm honored to be here.
And we wanted to talk a little bit about what brought you into doing this kind of work.
So I have been involved in specialty courts for about 10 years now. I started as a counselor working with juveniles. Then I moved on to being a coordinator for diversion court, a truancy diversion program in our school system here in Clark County. Then I was the coordinator in adult drug court, and now I'm the administrator over the specialty courts for district court. So I've always had a love of helping people succeed and, really trying to figure out what got them where they're at, trying to help them identify how they can improve their lives and be their better self or be more successful.
So it's very interesting how these specialty courts really integrate healthcare services into the criminal justice system. Can you maybe talk to us a little bit about some of the court initiatives? Maybe we could talk about a specific treatment court and some things that you think the community needs to know about some of the services that you're providing.
So specialty courts are treatment courts. So in looking at adult drug court, which was one of the first courts that we had out here, what it really looks at is your addiction driving the crimes that you have committed? So we have coordinators that go in and they assess the applicant, who then become our participants, and really look at, why are you committing crimes? Is it due to your substance misuse or different things going on? A lot of times, as most people know, there's a co-occurring disorder going on. So a lot of times substance abuse is also diagnosed with mental health illness, but not all the time. So it really looks at that driving factor of why they're committing crimes. So in mental health court, you don't necessarily have to have a substance abuse disorder. You're really looking at, was your thought disorder or your mental health driving the crimes that you have committed. So what we do in specialty courts is bring them in and we treat those different issues such as substance abuse. So we have co-occurring treatment, we have substance abuse treatment, mental health treatment. One of the big things that specialty courts really look at is when someone's coming out of being incarcerated, be it the jail system or the prison system, there's a lot of things that will block them from entering recovery. So a lack of identification, a lack of insurance, because if you're incarcerated for a certain amount of time, you actually become kicked off your insurance. So when they're released, they're literally released with nothing. A lot of people, if they had, employment, they're no longer employed. If they had housing, they no longer have housing. So you really have to treat someone's basic needs before you can place them into, recovery, in the recovery community.
So I'd imagine a lot of the folks that you're meeting with, they've had either mental health or substance abuse prior to maybe committing those crimes. What does the court do in terms of connecting them to services, or do you provide services on site? How does that work?
So the court, we have court coordinators. They are all clinically licensed. And what they do is they assess the participants coming in. And in that assessment, they identify different needs of that participant. So they identify, does there need to be a trauma focus? Is there a mental health diagnosis? Do they need co-occurring treatment? Do we need to get them stabilized on mental health medication before we even bring them in and truly start, treating them? And do they have to, get stabilized on meds? So we look at all those things at the front end. Do they need housing? Do they need supportive housing? Because are they coming from a house where everyone also has a substance abuse disorder? So we look at those things, and then we partner with different community agencies for sober housing, for substance abuse treatment, mental health treatment, inpatient residential treatment. And, we really utilize our community and the experts within the community to provide those services.
So it sounds like these court coordinators really are, managing the case throughout. What is their interaction with the judges, district attorneys? Kind of give us like the structure of how the court works and how these coordinators are interacting with them and providing this information about the individual's health care that might be helpful to the judge or district attorneys making decisions, with them as a team.
So one of the big things about specialty court is we do have that judicial oversight. So going into a specialty program is very difficult for the participant because starting off, most of the time they have to come to court once a week and they meet with the judge. And on top of that, the coordinator is really the person that is case managing that case. So they identify the needs, and they also are the ones that gather all the information and report it back to the judge and make those determinations. So based upon the specialty court model, we use incentives, we use sanctions, we use graduated sanctions. So we use things such as community service and things like that. Those recommendations come from the coordinator after staffing those cases with their treatment provider, their probation officers, and really that entire team of the defense counsel, the judge, and the prosecutor.
Okay, so a person comes into a specialty court, they have a substance abuse, mental health issue. The first person they meet, do they go before the judge, or the first person they meet with is the coordinator?
So they'll apply for the specialty court. The coordinator will review the case, and then they will meet with them, assess them, accept them, or say that they would be accepted into the program. Then usually it goes to the sentencing judge to sentence them into the specialty court program. Then they'll come before the specialty court judge and then officially be accepted, and that is when the process really starts. So they're either released to sober housing or they have their own residence that they can go to. And then the coordinator really is the one that drives, the treatment and everything.
So the coordinators make recommendations for care, and then the judge is reinforcing it with sentencing them, making those certain contingencies. And then you said that there's sanctions, and so if somebody may get sentenced also to community service or other types of sanctions as well.
Correct.
Fantastic. So it sounds like there's a lot of compassion in the court.
Absolutely.
For people with health issues.
Yes, I mean that's truly what the specialty courts are there for, is to really find out what's going on with that individual and really help them to discover, what's going on and work with them through those issues. And we are a long program. The minimum is 12 months. So a lot of our courts are 12 to 18 months. We have some courts that are 3 years by statute.
Oh, wow. So you really get to see them from like the worst possible state where they need the highest level of service to really see, either transformation or people, not doing well. And so it's good that you're able to be in their life for a long period of time.
So that's one of the key things with the specialty court model is, it's that long-term recovery system where, if they relapse, we are there. In order to graduate, you have to have 6 months of clean drug tests. So you really have that foundation of recovery before we graduate you and release you. And it's very rewarding for us along with the participants because we get to see them come in one way, and when they exit, we hear graduation stories all the time about how they're reconnected back with their family, their children, people that wouldn't previously talk to them. Some people haven't had employment for years, and now, they've held a job for the last 12 months.
So it really becomes a turning point in an individual's life, and you support them towards getting help and doing help-oriented activities, such as going to see a treatment provider, a psychiatrist, all the things that they need to be doing so they can develop some level of independence and prevent possible reoffending related to the substance abuse or mental health issues. So I have Stefanie Hui here also. She's going to be co-hosting with me the show. And Stefanie has a really big background in substance abuse and working with these different populations. She also runs a advocacy group here in Clark County for counselors who provide mental health services, and she's done a lot of work in terms of shaping policy along those areas. What are kind of your thoughts and opinions on experiences you've had working with the treatment courts and specialty courts here?
Well, Dee, I must say that I'm so excited to have you on today because I know the amount of work that you've done for our community. One of the things that I want to know, just because you have a wealth of knowledge and a lot of experience, and it seems like it stems from passion. I know you said you started in truancy diversion court. From then until now, what's been one of your, I guess, most memorable experiences working with some of these youths and families?
So I think for me, the most memorable was working with the juveniles because I was a juvenile counselor for, I want to say 5 years. I think 5 years. And having the kids come back, and I had 3 come back that went into the military, and seeing them succeed or having them complete high school when they came to me at 17 with 2 credits. Those were really large moments because us as adults, we understand what that means to have, a high school diploma and what that will mean for your future. And for them at 17, their brain just doesn't work that way. Right. So having them come back and visit me and tell me their story when they were 22, that was always really a big impact for me that I always wanted to see. It was also a big impact for me working with children who grew up within substance abuse within their family and their community. And that always made me want to work like the bigger picture. So working with the parents, working with, the community as a whole, right, to really try and address these different issues.
And I think a lot of people don't know the resources that we have in our community. So the specialty court program, I think, is one of those things. So we really appreciate that from you. So it seems like one of the most memorable things is when they do come back with a success story, or saying that the court system and the specialty courts program really did help them out, right?
Correct.
Yeah, so that's really good. And I think that, with you guys doing graduated sanctions and rewards, it's taking, like you said, that judicial and then putting a treatment spin on it, correct?
Correct.
Okay.
So, we also have amazing probation officers. So that's kind of the component that I don't think a lot of people get is these programs are very intense supervision. So when they come back into court, we have reports on them from not only their treatment provider, if they're in housing, their housing provider, their probation officer. So they really have a lot of contact with the specialty courts as a whole. And our probation officers are also treatment-based probation officers. So they're really looking at, okay, what's going on with this client? How can we assist them? We've had probation officers, really go above and beyond based upon the mental health or the substance use of the participants. And I don't think that's a picture that a lot of people have.
Yeah, I think probably when most people think of probation officers, they have a different picture of that. And I think being able to point that out, I think probably it relieves a lot of anxiety people might have about being in treatment courts. What advice would you give to an individual if they're considering entering into a treatment court or they're starting a treatment court? What's advice you would give them about entering that process and what it's about?
For a participant entering, I would say have patience because it is so much right up front. So when someone originally comes in, the major goal is to get them their basic needs met. And that is very difficult for a lot of people coming in because if you go to sober housing, you have to abide by different rules. Then you have probation rules. Then you have the court's rules. So just be patient in that very beginning phase. It does get easier. That's what a lot of the graduates will tell the other participants. It gets easier. But I would tell them to have patience and to really trust us and trust the system and really try and engage and take this time to focus on themselves.
Fantastic. Do the graduates get an opportunity to talk to new people coming in about their experience in treatment court and their successes?
They do. So when they finally graduate the specialty court, their judge lets them stand up and they always make a speech. Well, they have to make a speech regardless if they want to the other participants and the new participants coming in about, what worked for them, any advice to the new participants. And then we have a graduation the second Friday of every month where we celebrate them and all of their accomplishments. We put all of our specialty courts together and throw a celebration.
Fantastic. It sounds like you have a wonderful community developed in there of professionals working in the court who are there to help support people through their recovery, and also folks who've gone through that process who are able to mentor and give that feedback, which I think that level of compassion for folks who have really severe mental health issues, substance abuse issues, and are committing crimes in most part related to that, I think is so important. I think it's a really important message for our listeners to hear, is that if you do go into a treatment court, specialty court, they're there to help. They're not. It's not a court where they're looking to punish. They have the ability to punish if you don't follow through with the things that you're expected to do in terms of going to treatment programs, providing clean urines, meeting all the requirements and following these rules. And I think one of the things that you just brought up before that's so important is the first day it could be really overwhelming because it appears everything's expected for them to be perfect on the first day. Is that what the expectations are? Is there room for folks to have opportunities to grow, or day one they break a rule, they're throwing the book at them?
No, absolutely not. So thank you for that. We do. We have a great team. I am very lucky, and that's absolutely not the case. The biggest thing is really communication. So if you don't make it to one of your appointments or something happens, to just really have that open communication with your coordinator so that they always know what's going on when they walk into court, or they, update the team with what's going on with that case. But no, what treatment courts are always looking at is, what's going on? Why did somebody relapse? Why did this happen? So is it just because they don't want to be part of this program, or is it because, a life event happened? Because as we all know, those things take place. So it's actually better for those things to take place while they're involved and wrapped around with all these additional services where, it can really be processed with them, coping skills and different things like that within the team. And the team can support them, because that's always what their goal is going to be, is to support that person and really try and figure out what took place and how could that participant handle it different in the future.
Fantastic. And I had an opportunity to meet some of your coordinators. I was really impressed. All of them are, experts in mental health and substance abuse.
Correct.
They're all credentialed, have a lot of education, background experience. So the folks who are giving those recommendations to the court are people who understand addiction, understand mental health issues. When you're, if you enter a specialty court, you're not meeting with someone for the first time who doesn't have an experience working with someone in the situation that you find yourself in. And they're there to help. These are people who are trained to be helpers and to assess these kinds of issues and connect you to resources in the community. So I think that level of compassion is really important. And I think what you just talked about before is really good advice to people entering, is that they got to have good communication. Sometimes, we live life on life's terms. And, sometimes things don't go perfectly, but if the folks who are there trying to help you, advocate for you in the court, don't know what's going on, they can't advocate to you, to a judge, to a district attorney, to explain what's going on. And then they also don't really know your motivation for seeking help. I imagine many people who come into the court want to get better. They want to get recovery, even if they're struggling, to get it. And other people, may not be. And so I guess it's got to be a tough position for some of the judges and district attorneys to kind of sort out if the person is really motivated and very serious about getting help versus somebody who isn't that motivated. Maybe talk to us a little bit about that. And I think you've given us some insight that individuals should be giving, feedback, but if you have any other advice.
So we actually really don't anticipate everybody to be motivated coming into the program or ready to actually, engage in recovery or be in recovery at that point, because we're kind of going away from a phase system, but really how it's broken down in specialty courts is when you first come in, into really focusing on like detox, looking at withdrawal symptoms, what this participant's going to experience, and then moves into education. And then really the third and majority of the program, after someone's had enough abstinence or clean time, is looking at the processing. So why did this all start? How did it spiral and get to where it's at now? And really working with their counselor and their coordinators and their entire team to look at, what does this picture look like and really what's happening. So the motivation probably comes in more around the 3 to 6 months versus the very beginning. And we don't really expect that in the very beginning.
So you're looking right off the bat to stabilize the individual.
Correct.
And then once they're stabilized, to work on some of their issues, let them see some success, and hopefully motivation will kick in somewhere in that 3 to 6 month range, where you still have at least 6 months to another 2.5 years in terms of monitoring and supporting that individual through the recovery process.
Correct.
And it seems like each court has a very dynamic team. You have a judge, you have DA, the PD, treatment provider, and it seems like everybody is very well educated and trained on whatever it is a specialty court is, whether it's mental health or drug court, or even I heard there's a new gambling diversion court as well.
Correct.
So that's really cool. And so you said that the treatment providers are trained on evidence-based practices, so they understand that sometimes relapse is part of the recovery. And so, like how you mentioned earlier, they don't have to come in and do perfectly the very first time, correct? Because the treatment providers and the whole court team understand that relapse is part of just the recovery process, correct?
Correct. So the entire team understands that, and most importantly, the judge understands that. Mm-hmm. So you'd be amazed at how many people, really open up to our judges, and our judges really do take on specialty courts because with every single one of our judges, it's a passion for them. Mm. They all enjoy it. They definitely motivate our participants. Our participants will say, I enjoy seeing you every week. Some of them will be extended out and want to keep seeing them because they really enjoy being able to come in and update their judge every week or every 2 weeks or every 3 weeks. research has shown that 70% of participants, if they don't have that judicial oversight, will return to substance use. Whereas you will see a lot of our participants want to come in and give that update or be in, the A group, which means they're doing excellent and everything else.
Fantastic. So, I mean, it sounds like a lot of the good work that you're doing, you're able to put people on the right track who otherwise, had they not been given the opportunity of specialty court, might fall between the cracks.
Correct. I mean, we think so.
So, Dee Dee, we spoke a lot about the way the treatment court works, different treatment services that are available, and how compassionate the court is. I think a lot of our listeners would be very interested to see if this program is really cost effective. I know a lot that we've discussed prior to the show is talking about some of the cost savings that it provides to both the court and to the taxpayers here in the county. Can you talk a little bit about the cost savings and how that works?
So absolutely. So research has shown that with every participant, there's a cost savings of around $3,000 to $13,000. So with that being said, to house a person in CCDC or the jail, the Clark County Detention Center, it is $150 per day.
Wow.
So when they come into specialty courts, if we are housing them for sober housing, it could be $28 a day, or residential inpatient treatment is $110 a day, just to give you a few numbers. But on top of that, really utilizing insurance and different contracts that we have, different grant funding, and really working with our participants to get them the education and get them employed. There really is a cost savings.
So
along with the decrease in recidivism.
So it sounds like there's a direct cost savings right away.
Correct.
Is there also a cost savings because people aren't reoffending, they're getting better and getting healthy?
Correct. So there is a reduction in recidivism that has been studied more than any other criminal justice system in regards to specialty courts. And every time they do the study, it comes back and it shows that specialty courts truly do work. And so there's the long-term cost savings and the upfront cost savings.
Okay, so that's very interesting. So I know in some of the research we did about Clark County, it's about you're saving $3 for every dollar spent.
Wow.
So for instance, if you spend $1.4 million in a grant, you're saving somewhere between $2.4 and $3.9 million on that cost. So it's pretty amazing. And a lot of the things that sometimes doesn't get taken into account is some of the downstream expenses. So when someone's not reoffending, the police are being in contact with them. When they're getting better, they're not occupying the emergency rooms as much. So there's a tremendous amount of cost savings to society as a whole. And most importantly, you're helping folks who probably wouldn't be committing crimes if not for having a mental health issue or substance abuse issue get better and stay at a jail. I'm sure that there's a lot of families you've been able to keep together where their loved one might have been going away for a number of years because of the crime that they were arrested for.
Correct. And then in addition, participants, I think this is something that people don't take into account. A lot of people don't actually know how to use their insurance. So one of the things that they really learn is to utilize their insurance and understand the different, places that they can go that's in network, or, really how to stay medication compliant, follow up, with their doctors, and, really kind of get on that track.
Such an important part. I mean, think about it. If someone has a mental health issue and they need medication management and they have insurance, but they don't know how to utilize it or where to go, they're never really going to get stable. And if they're committing crimes because they're not stable, that creates a tremendous cost to the courts, as well as a lot of suffering for them and their families. So it's pretty amazing the work that you're doing. You're helping a lot of people be in a position to win who otherwise wouldn't be. And you're really a superstar in our community. We appreciate you, and thank you for being our first guest on our show. Just want to make a quick mention to our sponsor, TrueCare Treatment Centers and Illuminations Counseling has a 24/7 hotline. You can reach it at 833-203-2848. If you or a loved one needs mental health or substance abuse treatment, They also offer transportation to and from services, as well as having psychiatrists on site and addiction medicine doctors.
This has been Healthcare Sunday on 104.7 KJUL, sponsored by TrueCare Treatment Centers.